we tend to forget that when we are working, as young as we are and as strong and fit as we are, a certain time in age you have to retire. So when you retire, how do you sustain yourself? My name is Royford Kibara, County Commissioner Nakuru. Today we are gathered here with the CEO Huduma Center and the CEO Retirement Benefit Authority. The purpose of our being here is because the Retirement Benefit Authority have a 1 week sensitization program to discuss with the members of the public in Nakuru on the benefit of savings for their retirement. Those that are working in the mainstream national government, those that are working in informal sector, and all of us, including even those that are still working in government, they can still save in those schemes for retirement. The bottom line here is we tend to forget that when we are working, as young as we are and as strong and fit as we are, a certain time in age you have to retire. So when you retire, how do you sustain yourself? Now, the entry point of RBA, they would wish to use our machinery. These are the Huduma centers in the country. Huduma centers are run by the national government, and Huduma centers operate like a one roof, where various services for the government are put under one roof, and you can get those services here at once. And the national government administration has been giving the managerial function for the Huduma centers. Huduma centers have proved to be very effective, very efficient, and it is a model that can be borrowed. They have even won a lot of international recognitions because of the services that we render. So the Retirement Benefit Authority is coming in to have a desk where, because their law is to regulate various stakeholders in the pension administration. These are the NSSF, the Treasury Pension Scheme, and other players, so that they can regulate them, and also they assist in policy formulation on the management of the money that we save for retirement. Now, Nakuru has 11 sub-counties, like I said before, and out of its expansiveness, we have only one Huduma center, which is the Huduma center we have here in Nakuru. So the number of people who come here to be served is quite substantial on a daily basis. Actually, to me, it's the busiest, and again, it is very efficient. So we, through His Excellency the President, he has kind of directed that all the constituencies at least have one Huduma center. And because of resources, we have teamed up with our members of parliament in these constituencies so that they can give us the infrastructure, then we can do the employment and this other technology development in those Huduma centers, and we open them up. For Nakuru, very soon, we have concluded the negotiations with the member of parliament for Moro. We've identified land for the same, and we are very soon coming in to launch the construction of that Huduma center, so that the population that is in Kulesoi South, Kulesoi North and Molo can have a facility in Molo for a start, so that we can ease out the number of people coming to Nakuru here. Discussions are on with the the MP for Naivasha, MP for Rongai, and the rest of MPs, so that we can hasten that process, and we have those Huduma centers in those constituencies. So for today, mine is to join the RBA for the launch of the program. We have seen from the statistics that they have got that we have only, out of our 50 million plus Kenyans, only 26% of us are saving. That is far below our expectations, and we want to push that percentage to at least 90 plus, so that every Kenyan can save for retirement. We want to assure Kenyans that the money saved is in safe hands, will be in safe hands, so that that time for retirement, when it comes in, they will be able to get their benefits, and they can move on with their life. The same scheme again allows them to save also for the medical scheme, because it still becomes a challenge when we grow old. Now, like I've said earlier before, is an engagement that we have with the members of parliament, and all of them positively they have taken up the issue. You know, there's an issue of now identifying the land in those constituencies and then putting the structure. For Nakuru, I've said, because the challenge we have is where to, and the CEO will explain this, where do we put now that Huduma Center, which building? So we need to consult again with the area member of parliament for Nakuru East and West, so that we can have the space. Like we got the space here from the Postal Corporation, and then we have another one that can ease this population. It is a concern that we have seen. It is a concern that has been discussed with us, and we are working on it. We just need a bit of time to reorganize on the space and the infrastructure to put another Huduma Center.
Thank you, County Commissioner, for the remarks and the questions about devolving government services to the constituencies. Kwa majina naitwa Mogambi Njero, Acting CEO Huduma Kenya Secretariat. And I said thank you to the County Commissioner for addressing that issue of devolving services to the constituency. What Huduma is doing, as rightfully said by the County Commissioner, is partnering with members of parliament so that we can roll out constituency Huduma centers. Nakuru is one of the counties that has been identified as a priority county as we go through this process of going to the constituencies, and where we will be doing groundbreaking within the month of April in Molo. We're in discussions with the Member of Parliament in Naivasha and Rongai, so that we can then expand that service of Huduma centers in these particular constituencies. And we have also discussed with the County Commissioner, as indicated, we will be looking forward to identify a facility in the city of Nakuru, so that we can add an additional Huduma center as and when the resources then will be provided through the government structures. So ours is to request for the citizens to continue coming getting these particular services here at Nakuru Huduma Center, and to assure them that the government, through His Excellency the President, has directed that we go to the constituency. And this was actually captured recently in the launch of the Medium-Term Plan 5 for Vision 2030, so that we prioritize the issue of services and evolution of the same in the constituency. However, I would also want to mention, as we work towards the setup of this infrastructure, we have what is called Huduma Mashinani outreaches, where the center managers at the county Huduma Center are able to move to different sub-counties and villages and offer citizen services through Huduma Mashinani outreaches. So we are expecting that we'll have a mix of interventions to ensure citizens are able to get services. And also importantly, I would urge citizens, for services like following up on status, you do not need to come to this Huduma Center. Please call the number 1919 and we'll be able to give you the status of your service, so that we save in your time when you require to confirm whether your particular service is ready for collection. And I thank the citizens for the confidence, and I believe the queues we are seeing is because of the good services that they continue to receive here at the Huduma Center. Moving to the partnership, we are looking forward to work with the Retirement Benefit Authority for their services to be availed across all the Huduma centers. And this is just a clinic to appreciate the status of demand of these services within a particular county. And we are working with them to ensure that they deploy their services and staff in a number of Huduma centers. So this collaboration will be working towards enhancing the number that the county commissioner has talked about to be over 90%, where citizens are saving for their future. Kwa kweli, akiba ya gozi. Asanteni. We have 53 Huduma centers operational. For the last 10 years, we had only 52. His Excellency, the Deputy President, opened the 53rd about a month ago in Laikipia East, which is another collaboration between Honorable Mwangi Kionjori, the MP of that locality, and Huduma Kenya. The 54th has been commissioned in Ronyenjes. The 55th will be commissioned in Molo. We have 73 MPs who have written and requested to commence the discussion towards opening constituency Huduma centers. So we are looking before 2027 to have made strides, at least to get to those 74, where we'd then be working towards the 290 within the MTP 5 period, which is 5 years. Thank you.
Thank you very much. My name is Tom Kitanui. I'm the Director in charge of Market Conduct and Industry Development, the Retirement Benefits Authority. We've come here so that we can be able to bring our services. As Retirement Benefits Authority, we are the pension regulator in this country. We have over 1,000 pension schemes in this country that have been started. And all those pension schemes, we have members who are contributing to those pension schemes. One of our major mandates, or the role that we carry out, is to make sure that we regulate and supervise the pension schemes that have already been started, ensuring that we protect the members of those pension schemes from the time when they start contributing to those particular schemes. And more importantly, at the time when they exit, it's our responsibility to make sure that they get their payments as expected. In terms of development of the sector, this is to make sure that as we continue to engage, and as the Commissioner has said, we still have a very low coverage in terms of saving in this particular country. It is something that we have had a discussion. As a nation, we don't have a very good saving culture. And it's for that reason that as Retirement Benefits Authority, we want to ensure that we bring on board as many Kenyans. The 26% of the total workforce that has been registered is still quite low compared with other jurisdictions. And it's for that reason that we have actually said, in as much as we are not a devolved institution, we want to ride on the structures that government has put in place so that we can be able to reach out to other many Kenyans, especially those in the informal sector, in making sure that we bring sensitization, bring our services close to them. And it's for this reason that we have actually run the clinics in this country with the Huduma Kenya, so that we can be able to make sure that we actually appreciate the need that has come out in respect of the services that we are giving. We have actually rolled out these clinics in various centers. We have been to Kisumu, we have been to Kakamega, we are now here in Nakuru, we'll be going to Garissa, we'll also go to Nyeri, we'll also go to Embu, Mombasa. And it is actually but to make sure that we understand the infrastructure that is there with an aim of making sure that going forward, in that spirit of making sure that we bring services closer and making sure that those services are actually accessible to the population, especially at the time when they have retired. We will now ensure that we mount our services permanently in some of these Huduma Kenya centers. The program that we put in place as an institution for the next 5 years is to open at least 10 centers. Of course, we could do more than that, but we are looking at our ability for us to be able to have that available in those centers. So here in Nakuru, we have actually appreciated the potential in as far as the number of people who are actually coming out for services. As the Commissioner has said, one-stop shop. We wouldn't want to be left behind as an institution. And as a government agency, we are really cognizant of the fact that even as we continue to save towards retirement, there are issues that will come up. And we really want to make sure that we are available as going forward. So you'll be seeing us in some of these centers where we are visited. And we are really very grateful to Huduma Kenya Secretariat because they have actually gone ahead and the platform is there. It's us only to be able to plug in and we'll be able to give our services like the rest of the other institutions which are here. I think the legal framework that we have had in place for some time is not compulsion. Apart from the National Social Security Fund, which is a statutory fund, many Kenyans have not really come in to appreciate that there is need to save for retirement. Of course, notwithstanding that, we know there are very many other competing interests in terms of their resources. Issues of pension have not really been given the prominence that is required. And it's for that reason that government has given us this responsibility so that we can make sure that we give them the information and more importantly, those now who are coming forward, for them to know that the money that they set aside for retirement is safe. I think we are coming out from a situation where people did not have a lot of confidence because the money that they would put aside, they weren't quite sure whether that money will be available for them for retirement. But I want to give you assurance that with the Retirement Benefits Authority having been put in place, we give assurance to the people of Kenya that the small amount of money that you'll put in place, and we've been told you can save as little as 50 shillings. We actually have a scheme which is actually accepting up to 20 shillings per day. And this scheme is really meant to make sure that those of us in the informal sector who earn on daily basis will actually be able to set aside that money. And we give assurance as an institution that in as much as resources are not there, the small amount that you put in place will be safe going forward. We know we are actually living in hard times, but that doesn't take it away. That's actually, there will be a time that you will need some money to live on at retirement. So as we appreciate that we really need to ensure how well do we apportion the money that we have in place, we are coming forward to say government has given incentives. For the money that you set aside, there are tax exemptions that have actually been given to contributions that you are putting in. Government is saying if you can set aside up to 20,000 shillings every month, then that money is tax exempt. And also, the investment income that comes from that amount of money is also tax exempt. So as we live through the difficult times, I think our focus is to sensitize the public to know that it is important that you also think about your life after retirement. Government has done its part to see whether they can be able to take care of the old people, but we wouldn't want our generation, when they retire, to still live on government. The small amount that we get in place, let's see how well we can be able. And as I said, it could be as little as 20 shillings, 50 shillings. What are we doing in as far as employers are concerned? It's very key to us. We are reaching out to employers to make sure that they save, they establish schemes. And not only establishing that, they also contribute. So that as a member or an employee actually contributes, the employer can also be able to put in some amount of money. And the number of schemes that I've talked about actually have been established voluntarily by employers. So we are on course. And we sensitize employers from time to time. It's one of our things that we need to do going forward. The Retirement Benefits Authority is not just concerned about you accumulating your funds. We also come in to ensure that your benefits have been paid accordingly. And the law as it is now provides that within 30 days after you have retired, your benefits need to be paid. And if for any reason those benefits are not paid on time, then you have recourse. And our officers who are here today will still be able to explain to members of the public that you can actually be able to come to RBA free of charge. We'll be able to take up that case and ensure that we follow up with the trustees to ensure those payments have been done. If indeed the issue of East Traffic Portland Cement is something and we have a member who has not been paid, then I want to encourage that member to come forward to us and we'll be able to intervene and we ensure that those payments are paid. So we have a mandate to ensure that those benefits are paid within the period that has been stipulated.